More than 100,000 Guyanese received the first dose of a COVID vaccine as of Tuesday. Approximately 5,809 persons were vaccinated on Monday. Describing the latest achievement as a significant milestone, Minister of Health Dr. Frank Anthony, during his daily COVID-19 update, lauded the efforts put into the exercise by healthcare staff.
We have exceeded 100,000 doses. 100,000 persons receiving their first dose. And this is across Guyana. We've had people coming out, our teams going into villages. So I think the health workers who have been on this vaccination campaign has done a remarkable job for us to achieve this milestone. So I want to commend them for the job that they've done so far. But we still have a long way to go to ensure that all adult Guyanese and other persons living in Guyana receive their jab.
In order to bring a possible end to the pandemic, health authorities are targeting 500,000 adults for vaccination against the deadly virus. Persons 18 years and above became eligible to access the vaccines on Friday last. Since then, the daily average of persons receiving the jabs has increased drastically. Minister Anthony informed that the vaccines can also be accessed by the migrant population residing in Guyana.
Our policy with vaccination right now is to ensure that whoever is in Guyana, and once you're an adult, that you will get a vaccine. Migrants who are here would certainly get vaccines. Other nationals who are here working in different establishments, once they're here for a protracted period, we'll also be able to give them vaccines.
Meanwhile, April has to date recorded the most new COVID-19 infections and deaths since the start of the year. In excess of 1,700 additional persons were diagnosed with the disease, while 40 have died. Throughout this month, an average of 70 persons have consistently been hospitalized at the infectious disease hospital at Liliendal, East Coast, Demerara. The Ministry of Health has noted with concern the high incidence of young persons that are being admitted to the hospital, requesting assistance with breathing. The Pan American Health Organization recently disclosed that the rise in new infections and deaths in Guyana are as a result of a new COVID-19 variant circulating in the country. Health authorities have still been unable to confirm or dispel the claims since the country does not have the capacity to test for other variations of the virus. Meanwhile, at the ports of entry, the protocols which allow for the testing for the common SARS-CoV-2 variant, which was first detected in March 2020, are still in place. Local patient samples are expected to be sent to the Caribbean Public Health Agency to be tested for the new COVID-19 variant soon. Temika Rodney reporting for the HGP Nightly News.